Well, TrueCare has launched its new street medicine program, which delivers compassionate, personalized health care directly to people experiencing homelessness. Here to tell us more is the Vice President of Government Community Affairs for TrueCare, Anthony White. Good evening, Anthony. Thanks so much for being here.
Good evening. Thank you for having me.
So for those who don't know about TrueCare in general, what do you guys do? Who do you typically serve?
Yeah, so TrueCare is a community health center, which basically means we're a primary care provider of health care, but we focus on underrepresented communities, primarily low-income families, those that are often overlooked by the other healthcare systems.
And so with this new initiative, how exactly are you able to kind of target like the local homeless population? Because sometimes it's not easy to get in contact with the people who need the care.
Yeah, we work a lot with other organizations that are doing outreach to the different homeless communities here in San Diego. So our medical providers work along with them, follow them. They've often developed relationships with these people. So bringing healthcare to where they are, where the need is part of what we want to do.
Yeah, so let's talk a little more about the street medicine program. Maybe when you guys officially launched it, I'm sure it was recently or it's upcoming, but what exactly it'll look like and what are maybe some of the key things or the things that are needed?
Yeah, so the reason we provide this kind of what we call street medicine is because there's a lot of barriers for these people coming in to get care. They're not able to find transportation. They often have all of their belongings with them. They can't bring them out. So we want to bring healthcare to them so that they're able to care for themselves, try to get better. What we see is these people often use the emergency room as their primary care provider. So one of the ways we're trying to decrease our emergency rooms being filled with people that don't necessarily need to be there. Their condition maybe isn't quite as what's needed in a hospital. So if we can provide that primary care where they live day to day, then that helps the healthcare system in general.
How are you guys able to accomplish this? I imagine is it free of charge for the people who are taking advantage of these services?
It's free of charge, yeah. So we don't charge anyone. The majority of these folks are eligible for Medi-Cal, the state-funded program that provides health care. So we're able to bill for those people. For other people that don't have that for some reason, we still provide the care. It's part of the mission of our organization to provide care regardless of a person's ability to pay or regardless of their circumstances at all.
And do you find that maybe some of the things they actually need when you find some of the people that you're serving, it is something simple that can just be administered right there, like a flu shot or something, or some simple medicine that really doesn't involve that emergency room visit like you were talking about, that could really be sorted out by the care that you're providing?
Yeah, no, absolutely. I mean, sometimes they have the flu and they just need some kind of flu medication, or they have, you know, oftentimes because they're out in the elements, there's issues that happen because of that, and if we're able to intervene and make sure that doesn't amplify and become bigger and bigger, we're able to care for them, as I said, keep them out of the emergency rooms.
Wonderful. So when did this all get started? And I imagine you guys want to keep this going as long as possible.
Yeah, no, absolutely. We started relatively recently. Street medicine is a relatively new methodology, but it's understanding really we need to bring the medicine to where folks are. I kind of liken it to telemedicine. During COVID, we changed the healthcare system so that people could see their doctors, even though they couldn't go out. Here, we're doing kind of the same thing. It's just with a different population.
Wonderful. I love what you guys are doing. I mean, the telemedicine thing really stuck around. I've got a virtual appointment later this week, so it's like clear that is something was working about that. So
Absolutely.
It's great to hear what you guys are doing and providing it to a community that really needs it. I know we have a really high homeless population here in California.
Yes,
so thanks for sharing, Anthony.
Thanks.
We appreciate your time. Thanks
All
for
right.
being here.
Thanks, Kasha.